Greetings, everyone. Good evening from wherever you are joining us. Once again, it's my pleasure to welcome you to our Thursday evening training. So, wherever you might be here on our continent of Africa or further afield in the diaspora, it's a very warm welcome. And I hope that this finds you well and ready to join us for our training session today. For those who are new or maybe they are our guests, my name is Betty OLOO, a long-time Neolife distributor and director. Very happy to spend time every week speaking about our products and how to position ourselves and the products so as to be able to help all those who come to us or whom we come across in our sphere of influence. So before I go on, I once again, we continue to sympathize and keep in prayer our brothers and sisters in Kenya, in East Africa, during this difficult time in the country. And we hope that all will be well in the long run, or short run for that matter. So without further ado, we'll get into it. Once again, you might have seen in your invite that we are going to continue with our Q&A, so as to catch up with some of the questions which have been pending. And so the topic today is once again Q&A. And also just to inform you that if you have a question, you can always send to us. The contact information is usually available. And if you need an urgent answer, we can answer as quickly as possible. But we also normally include the questions in the Q&A just so that we share what we come across as we go about doing our business. So today, the first question that is a leftover from, I think, from June, someone wanted to know about asthma. And asthma is a respiratory condition that can be maybe caused by certain triggers that might be allergens or certain types of food and so on. So the first thing we recommend is, where possible, identify and avoid triggers. For example, if it is a certain kind of foods that triggers the asthmatic attack, or certain kind of allergens, if it's something that can be eliminated, then we advise that you remove them so that they don't cause these problems. In addition to that, we recommend including healthy dietary fats in your diets, because this will also assist. And there are also certain breathing techniques that, if learned, may help, especially when on the onset of an asthmatic attack. It may help the person, maybe if they do not have an inhaler at hand, it may help them to get their breathing in control. But of course, there will be inhalers and other interventions that can also be used. On the Neolife side, what we normally do is recommend supplements that will help in dealing with this issue. It's not something that will rectify the situation instantly, but it is to help the body to resolve this problem over time. So the first recommendation will be herbal respiratory complex. If it is a young child under 12 years old, we recommend that you break the tablet in half so that they get a half dose. And then we recommend also omega-3 salmon oil that helps to resolve the inflammation that is associated with asthma. We also recommend flavonoid complex. And if you do not have flavonoid complex in your market, you can also use vitamin C. Flavonoid complex, just maybe in case you are not aware, also contains a certain amount of vitamin C, including the members of the flavonoid family. Then we also recommend either good exposure to sunshine, or if that is not quite possible, then you can also supplement with vitamin D. So just to again remind you, if you are dark-skinned and living in a temperate climate, then it may be necessary for you to supplement with vitamin D, especially in the cooler months when the sun is not so strong, because for darker skinned people, brown skins and dark skins, we tend to actually have too much protection from the sun's rays, and this might limit the amount of vitamin D we are able to make, especially during the winter and autumn months. Then the next question was about bipolar mood disorder. Again, just to say here that these mood disorders are sometimes worsened or affected by poor dietary habits. So our first recommendation of the lifestyle side will be to eliminate sugar, avoid junk food and fast foods and excessively processed food. So the first stop here is to remove problem foods from the diet in case they are worsening the symptoms or in some way affecting the bipolar mood disorder. Then we also find that ensuring good sleep and rest will also help in this condition. With the supplements, we also have supplements that are recommended. Omega-3 salmon oil is one of them. Also, mind enhancement formula. We also recommend vitamin B complex. And once again, we recommend vitamin D or sun exposure. And just in case you are noticing, for example, the Neolife has recently added a second vitamin D supplement to our range here in Africa. And the reason for that is more and more research is coming out that shows that vitamin D is not just a vitamin, it's also a very important hormone that plays a role in very, very many processes in the body. In fact, it turns out that every cell in our body has got a vitamin D receptor. And when we get good exposure to sunshine, some of these rays can penetrate as deeply as into our bones, where they are going to help in strengthening the bone by helping us to absorb calcium more effectively. So if you notice that we are often speaking about vitamin D and sun exposure, it's because there is a lot of new work that is showing that it is very crucial for our health. And maybe you might be aware that in former days in European countries, especially people who are suffering from illnesses to do with the respiratory system, often used to be asked to go and live in sunny parts of the continent to help them to get well. So they had an idea there, and I think new research is just showing how much importance we should give to vitamin D. And so that is why it's becoming a more and more frequent recommendation in our products recommendations. Then the next question I had was PCOS, polycystic ovarian syndrome, which is an illness affecting women. This is a condition that is associated with the problems to do with sugar metabolism. So the first recommendation is to test for diabetes or pre-diabetes. Just in case it's not already been tested, it is actually linked to problems with the sugar metabolism. So that's one recommendation. Hand in hand with that, we also recommend eliminating sugar from the diet and also eliminating processed carbs and junk food. Then we would say opt for low amounts of non-processed or minimally processed carbohydrates, so as to deal with any of this side of a problem that could be getting caused by problems to do with pre-diabetes or diabetes. So that is the thing about PCOS. Remember, this affects the ovaries, and it is one of the conditions that actually tend to reduce fertility in women. So if you're a woman who's maybe planning to have a family, or you have a family history of diabetes, then our strong recommendation is to attend to that by testing and then going into the lifestyle and dietary habits that support a resolution of diabetes. We also have supplements, of course, that will help with this. And so for PCOS, our recommendation would be botanical balance if there are issues to do with diabetes or pre-diabetes. We also recommend Pro Vitality, recommend herbal feminine complex, because PCOS is also linked to an upset of the female reproductive hormones. In some cases, it is noticed that a woman will then start producing more testosterone than she's supposed to have in her system. So herbal feminine complex should help with rebalancing the reproductive hormone of the woman. And we also recommend, in addition, cruciferous plus. So for PCOS, those are the recommendations. If there is sugar or diabetes issues, botanical balance is going to help with that. Provitality will help with the general supplementation, and then herbal feminine complex to help with balancing the hormones, and cruciferous plus to help resolve the unwanted growth, that is the cysts. Then another question was, I think, one also that we have been receiving fairly frequently, and this is about autism. So in this case, there was a query whether what can be done by a person who wants to start a family to avoid autism. Unfortunately, we cannot guarantee that we are going to prevent autism before birth, but what we do recommend is to avoid any exposure to toxic chemicals as far as possible. We know that today the toxic chemicals come from all types of different things. It could be from personal care products that we're using for self-grooming. It could be from food that we eat. It could be from environmental pollutants. So there are many sources, and so it is much easier said than done to avoid all this exposure to toxic chemicals. But that is why I said, as far as possible, any that can be excluded, for example, some that might be additives in products that we use can be relooked at. So we look at whatever we are using, if they have got possibilities of toxic chemical. A lot of this information would be available online if you're using a product you're not familiar with, to find out whether it is a toxic one. So you know that our Neolife products are non-toxic. And so when you're using our products for cleaning your home, for personal grooming, and for cosmetic purposes, you are going to be safe from this type of problem. Then again, from the Neolife supplement side, what we would still say is for the expectant mom and the people planning to start a family or to have a baby, to use our recommendations for prenatal supplements. So we have Provitality, which contains carotenoid complex, threonine, multi, and omega-3 salmon oil. All these play important roles in the life of the expectant mom. We also recommend vitamin D. Once again, we recommend B complex and multimineral alfalfa. But as I said, these are all precautions that we can take, but there is no guarantee where autism is concerned, because there is still discussion as to what might comprise causes of it. It's not really settled as to where exactly it comes from, whether there's a genetic component, there's an environmental component, and there is a toxic load component as well. So these recommendations is to help with the expectant mom to have everything that Neolife can provide, that she can give her body to give herself the best chance of this. Then another question was someone who wanted to know what to recommend for epicondylitis, which is commonly we call it tennis elbow. It's a problem that is common with tennis sports people who play tennis and other such sports that require repeated movement of one joint. So you can imagine someone who plays tennis, they're using their forearms, maybe of their right hand, over and over again during practice, during play, when they are playing maybe the sport, and when they are competing. So this repeated, chronic repeated movements does tend to harm the joint in the long run. And sometimes it could also be that one's job or the type of machinery that we use in our work might also cause the same type of repeated movement over long term. So the short-term thing that we can do is to apply ice packs and rest the joints, because the problem is related to overuse of the joints. Maybe there might be a recommendation to immobilize the joint to give it time to rest and heal. A physiotherapist can recommend exercises to rehabilitate the joints. And your Neolife supplements that we recommend will be omega-3 salmon oil, which is going to help to resolve the inflammation in the joints. We also recommend full motion that is going to help in repairing the joint. And we recommend as well flavonoid complex or vitamin C, which also plays an important role in these inflammatory joint problems. So those are the 3 recommendations, as well as some lifestyle points. The next question was related. This was on this hand, the person wanted to know what to recommend for knee pains and difficulty in moving the knee joints. So again, knee pain can be from movement, chronic movement that eventually wears a joint out, but it can also be as a result of having put on a lot of weight, because remember, the joints and the ankles carry the whole weight of the body, which means that they may struggle if we put on a lot of weight. So one of the recommendations will be to consult a physiotherapist for exercises that will help to mobilize the joint and to keep it moving, because joints only heal when they are able to move. They require movement, even if it's a small movement, so that the supplements and whatever we are taking circulates within the joint and heals the joint. We also recommend that weight reduction, if the person has put on a lot of weight, then maybe to take steps to reduce body weight so as to reduce the pressure exerted on the knees and the ankles. So a physiotherapist might help with some exercises. And then with the Neolife, we recommend, once again, omega-3 salmon oil to help resolve the inflammation in the joint. We recommend full motion and flavonoid complex for that. And as I said, remember, the supplements go hand in hand with lifestyle changes, because that knee will need to be exercised so that it heals, and also that it retains its range of movement. When we stop moving a joint, it loses its flexibility. And that means that it's more and more, it becomes less and less flexible and impedes the movement even more. So although when the knee is paining, we are not saying that it's the time to go and practice for a marathon. We are saying that find small movements that can continue to exercise the joint so that the joint retains its flexibility. Then another question about autism. In this case, it was a young person, not a child, and not an expectant mom. So this is a young person living with autism. So we again recommend gradual progress to healthy diet and elimination of junk food. And the reason we mention gradual there is that it's not always easy for people living with autism they tend to struggle with different types of food. And so it may take time for them to change from maybe some foods which are not so healthy to a healthier choices. And it is better not to try to force them, because it might be actually quite difficult for them to change. So it requires patience to help them gradually introducing better, healthier foods, and supporting them in trying to change, to accept those foods that are healthier. And as they get into healthier foods, to eliminate the not so healthy choices. Again, here we have problem foods that would make the list of those that might need to be gradually eliminated. Foods that are wheat-based, foods that have got dairy, and foods that have got chemical additives in them. So little by little to remove these foods and try to replace them with better choices. Then there are a number of supplements that are recommended for autism. We have vitamin B complex, we have omega-3 salmon oil, and again, multimineral alfalfa. The multimineral alfalfa and B complex tend to be fairly large tablets. So I would say if the person struggles to swallow, which can also be a case, then we may want to either grind the tablet or break it in half to make it easier to swallow. We recommend vitamin D or sun exposure, and we also recommend Betagard because some of the people living with autism struggle to eliminate chemical additives from their bodies. So Betagard is going to help with the detox, which they might need assistance with. Then the next question was about boosting the immunity. So someone wanted to know supplements for boosting the immunity. Again, here the lifestyle recommendation would be to eliminate unhealthy foods and habits and to get active and increase exposure to the sun to boost the immune on the lifestyle side. On the Neolife side, we recommend Pro Vitality, Neolife Shake, and Betagard. If the person is not able to get good sun exposure, then again here it would require sun exposure would be even more important. So Pro Vitality, Neolife Shake, and Betagard will help in boosting the immune system for that question. The next question was about hair loss, alopecia. This has got different sources, and our supplements will not help all cases. The only cases which we can help with would be hair loss due to nutritional deficiencies. The nutritional deficiencies can be the result of something like extreme dieting or certain kinds of food preferences. It could be due to treatment with chemo medication, and also it could be due to hormonal imbalance. So those are the ones, if those are the causes for the hair loss, we may be able to help the person. Unfortunately, other causes of hair loss can be because the hair follicles, that is the cells that out of which the hair grows in the skin, might have been killed, for example, by exposure to chemicals like some that are found in some of the hair grooming products. Or it could be a hereditary thing that there is hair loss, as happens, let's say, with some people as they approach middle age. So depending on the reason for the alopecia, we may or may not be able to assist. But where we can assist, we recommend B complex, vitamin A plus D, and herbal feminine complex for the women who have got a hormonal imbalance. These tend to happen, for instance, as ladies approach menopause or after menopause has begun. The change in the hormonal mix of the woman can actually lead to hair loss. So herbal feminine complex may, in some cases, help. And we also recommend Betagard that might help in the case where chemotherapy has been completed. We would detox the person using Betagard, and as they detox, it may be possible to regrow the hair. The next question was about erectile dysfunction. So in this case, we have some lifestyle recommendations. The first one is to eliminate substance abuse, because erectile dysfunction goes hand in hand with the abuse of substances, for example, excessive use of alcohol or something like cannabis and so on. Then the other recommendation is to adopt an active lifestyle that includes weightlifting, which helps men to boost the amount of muscle they have in their skeleton. And this also helps to boost the amount of testosterone they have in their system. As I think I've mentioned previously, men's health and their testosterone levels are quite linked. So this would be a lifestyle recommendation to get more active. If one has got a sedentary job, then to include some kind of activity, maybe join a gym or a club where you can play a sport or have some kind of exercise. Sun exposure will also be helpful, and stress resolution. So if the man has got a stressful job, this can be or some stressor is in their life, this can lead to erectile dysfunction. That is difficulty in getting or maintaining or sustaining erection in a man. On the Neolife side, we have got good recommendations. Herbal masculine complex, very useful there. Chelated zinc and vitamin B complex. We also recommend that a good intake of healthy proteins, and if this can be supplemented by Neolife Shake. if a person would like to do so. So herbal masculine complex, chelated zinc, vitamin B complex, and possibly Neolife shake would be useful here to help with this condition, because you remember that proteins play an important role in the manufacture of sperm and semen. Okay, then we go on to the next question. This one, someone wanted to know what to recommend for backache. And on the lifestyle side, we recommend avoiding a sedentary lifestyle. That is a lifestyle where there is a prolonged period of sitting and not moving around. So avoid slouching when sitting, because it puts a lot of pressure on the spine when we are sitting, and especially when we are sitting in a slouch position. Then I also recommend to consult a chiropractor to help with spinal alignment, and also exercises that can help to strengthen the muscles that move the spine. And they can also recommend massages that will help. We're hand in hand with that, we recommend the use of omega-3 salmon oil, CalMag, and Full Motion. These, once again, are the supplements we recommend for most problems to do with joints. And a lot of the problems that lead to backache is problems to do with the joints, either at the hip or in the general area of the lower back, because of prolonged sitting, which puts strain on that part of the body. So those are the recommendations. You can consult a chiropractor to help with spinal alignment in case the spine, maybe some of the discs in the spine have gone out of place, then that might assist. But the supplements also have their role to play in reducing inflammation, repairing the joints, and restoring flexibility in the joints of the back or the spine, that is. The spinal column. So then next question was, someone wanted to know about candida or candidiasis, yeast infection that tends to affect people, especially women, and especially expectant women tend to see this. And the first thing to say here is that often candidiasis, again, is linked with pre-diabetes or diabetes, or a weakened immune system. So those are places to check in case that is what is at the root of the candida infection. Here I'm thinking especially if the candida infection keeps on returning, that maybe it has been treated and then it comes back, and then it's treated and then it comes back. Then that would be a warning that there's an underlying cause. In the case of pregnancy, it may simply be that the changes in the hormones with pregnancy might make one susceptible to candidiasis, but it could also be that the sugar metabolism in the person is not going very well. So the next lifestyle recommendation we would have, therefore, in the case of candidiasis, is to eliminate sugar and to minimize refined carbohydrates, and then to add fermented cultural foods of your choice to your diet, because this is going to bring in friendly microbes that will help the body to deal with the candida yeast. So if you have got, for example, some of the people in my country, they have got some ways of fermenting milk, which adds lots of good friendly microbes. There are people who ferment vegetables. There are people who ferment different types of drinks. Here, I'm not talking especially particularly of alcohol, but there are things like fermented porridge and all these. Yogurt would be good, but a lot of the yogurts are excessively sweetened, which would defeat the point of eliminating sugar. So if you are to take yogurt, then the yogurt we recommend is the non-sweetened one, because most of the yogurts, they say they have added fruit, but in addition to the fruit, there's a lot of sugar, which defeats the benefits that we would have got from the yogurt. From our side, I know that many markets do not have acidophilus, but if you do have it, then acidophilus is a good supplement to combat candidiasis. Where there is no acidophilus, we'd also find that fiber tablets is going to be helpful because the friendly microbes feed on fiber. And when we take fiber tablets or fiber in our diet, we give them their favorite food, which helps them to multiply. And that way they are going to attack and subdue the candida and thereby give us a long-time solution to the candidiasis. Then garlic allium complex, also very important. It kills microbes in our bodies, unfriendly ones. And flavonoid complex will also be the third recommendation. So for candidiasis, fiber tablets or acidophilus, garlic allium complex and flavonoid complex. Where you do not have acidophilus, you can pick some of the cultural fermented foods in your culture, or you can choose unsweetened yogurts if you are not lactose intolerant or you are able to deal with dairy. Okay, then as I see the time is getting away, maybe one or two more. The next question was about endometriosis. So here our recommendation, endometriosis is another one that has got different causes. And what we'll recommend is cruciferous plus, omega-3 salmon oil, multimineral alfalfa to help replenish what would have been lost with during the bleeding, and then herbal feminine complex to help with the hormonal balance that might be necessary to resolve the endometriosis. Endometriosis in some cases is actually autoimmune. So for that reason, as I said, there are many different causes, but if it is familial, it could be also autoimmune and it could be for other causes. So we recommend cruciferous plus, omega-3 salmon oil, multimineral alfalfa, and herbal feminine complex. Then the last question for today is going to be someone wanted to know about acne. So acne is skin eruptions and pimples that sometimes is associated with young people as they going through puberty. There are usually a lot of hormonal upheavals that is associated with the onset of puberty, and the body can react with these skin eruptions. But in addition to that, symptoms are often worsened by junk food, too much sugar and sweets in the diet, or the use of harsh skin cleansers, because a lot of times the acne may be also go hand in hand with oily skins, and a person may try to use cleansers in the hope of reducing the oiliness of the skin. But unfortunately, if we use a harsh cleanser on oily skin, it causes the skin to produce even more oil. So this turns out to be counterproductive. Certain medications also can lead to acne, as well as in some cases, stress can lead to acne. So for it, we recommend that we use 2 supplements that we take in and 2 products to apply on the skin. The first is vitamin A plus D, and the second is chelated zinc that we will take in. And then for skincare, to use gentle makeup remover, which is from our nutrients range. It's very mild and can be used for cleaning the skin without agitating it. It will reduce the oiliness because it is quite effective, but it will not aggravate the skin to make it produce more oil. Then you can apply also aloe vera gel. If it's someone with dry skin, you can add a little bit of glycerin or lotion to the aloe vera gel if the skin feels very dry. So I think that we shall stop there for today. And I want to thank you very much for having spent the time. I hope that you have found the session useful and we have touched on your question. But as you know, we always come to your question eventually. So if we did not get to it today, I want to encourage you to join us each time we have training, whether it is Q&A or any other training, because it is my hope that you always find that our sessions are beneficial for you in one way or another. As we are beginning the new month of July, I hope that in spite of the challenges that have been going on, you are able to keep a positive outlook, and you are, as always, in our prayers, that you'll be able to fulfill your goals and that you continue doing the good work that we are doing. Because I think for many of us who've been in the business, we know that we do make a very positive difference in the lives of the people that we meet. And this is what I encourage you to continue doing. And so without further ado, let me pass you on to Pascal. I've stolen a little bit of his